All right. Ashafo Ichichamo. Saso emamo afishapa. Moti enkache. Sani de bia no ni edika ni edihwe ena de bia ye de bremo. We eye community inform. Nene ekopie mu wo Achiato a ewo Ganof Municipality. Na hona the Ganof Municipal Assembly no akosi health facility asi ho. Ye commission no anase bia no ewo 3 December 2020. Na ekosi ne facility no asi ho. Enye adwuma ye. Na we na yebisa se na de na aba na de na asi na de na ekoso na ye doso mu epushi ahoma na nyame ya adom yenya the Health Directorate owo Ofankor District Hospital ye Dr. Elsi na ye na de twon komebisa no se eba ne san na hospital kama yesi up to now hospital no yenye emu adwuma anase ye commission no akoye bosom dan a esi ho na sane ye ka komedi no kwakwanum no yana kasa yen kanasem me ono akasa akanasem ahwefo kasa ne yepoto kasa na se wi a ebechechim ewotwe kasa ne mu ama wonso atibi nti obi a benya ne chefa na we ye phone so nkomo nti tiebi na wonso ne woka na wonso betumi ache wono ache wadwen we eye community inform ebo Agitech Media Network. Subscribe to our YouTube channel eye Agitech Media na di echi subscribe na nima ye wo nyina no wonso benya bi ahwe na Dr. Elsi come to
give us money that would need to operationalize it. You can't hand over an empty building to the Health Directorate. Because we don't generate funds as an entity. We can't charge for the work we do, so we don't generate money. So until Assembly releases money for the facility to be operationalized, it's not enough to build a structure. However, we put pressure and we're able to get them to buy items worth about 16,000. That's table, waiting chairs, DP machine, weighing machines. Those are with us now. We've also spoken to private facilities to support us. So Fayad hospitals and some other hospitals have purchased delivery beds and then CTG, what used to monitor the baby and the fetus and the mother. The Health Directorate has been able to get money by talking to other organizations in the district. And through that money, we've been able to fix the water, put weedicide and weed the place. And then we've also gathered cleaners from the hospital who we pay to go and clean the place. We've also built a signboard. So we are working on it. That is that we cannot go at the rate at which we would have gone if Assembly released the money in bulk to us to do. So we, together with our private facilities and other interested supporters, are the ones doing it now. So that's where we are.
Okay. But so when are we going to see that?
We plan to start in January because actually I'm sure you've noticed that we've come to clean, we've come to connect the water, we worked on electricity, we've put up the signboard, and what's left is the chickens that we are coming to buy. We put to the side, we gathered and burnt what was there last week. So it's left with the chickens. So please, for whoever is interested, let's try them that the Health Directorate is working on it. But you could also talk to Assembly. That would make it faster. But because using our funds means that we can't do it at once. We do this week, next week we do the other thing. So that's why you see every other week you see something. Some people are cleaning, someone is reading. We can't do it. Ideally, it should be all done. Maybe this is 20,000. It will cover everything. Purchase of gravel, purchase of the pump, everything in the facility, hospital beds. We've gotten some from the municipal hospital, but those are spoiled beds that we are fixing.
For the Assembly's budget, are you not part of the Assembly's budget?
We are part of Assembly's budget, but let me be frank, we don't get support that much. So we run on our own. But as a facility, we can't charge people for COVID tests, we can't charge for contact tracing, we can't charge for all our public health interventions, malaria and distribution. We are not to charge for the monitoring of public and private facilities. We don't charge money for it. So that means the Health Directorate does not generate because we can't charge you and make IGF. You understand? So there's no IGF to fall on to operationalize the facility. But MOH or GHS cannot, it's not their responsibility to also come and do that. It's the Assembly that does this thing. They can't come from their place to come and create a hospital for you. They have released human resources. We've gotten all of them. Last year, after the commissioning, we got all the human resources that we needed. But unfortunately, because Assembly didn't bring money, we have assigned them to other facilities pending the activation. When we open up, then they will come back. We requested them for Achiato. But they are currently searching at other facilities, so Achiato is better. So they know they're supposed to be at Achiato. Assembly delayed a bit, so this is where we are now.
Okay. When Mrs. Ankrah was commissioning it, was it not anything that she left behind that as this new MC has come?
No, they didn't. Assembly doesn't really. I think it's because of pressure, but the health support is not as much as you expect it to be. So nobody supported us. Now there was MP. MP is the one who actually when it comes to hospitals in the district, it's MP who's the supporter. I think that did the Achiato, that was the Ankrah project. But everything else you see, it's Honorable Moses. From even our activities, our campaigns, he supports us by releasing funds for, maybe he pays some of our data officers, or he gets assemblymen to come and sit in for our launches and spread the word, those kind of things. But in itself, we don't have that support. We are under them.
Okay.
We're supposed to have operationalized it. It's not MOH or GHS that can do that at the regional level. It's at the district level.
Right.
What they have done is, that one even took from January up to about middle of the year before we could get those items, putting other people's support. So that's when we have got the delivery beds and the other beds from other places. So we have them with us now.
Okay. So January, what date is it going to start, God willing?
We can't give a date because the Health Directorate is doing it after when we get money. So after, like last week, Fayad gave me delivery bed for the pregnant women and then the CTG for monitoring the fetus and then the mother. Last week, we used our money to get the electricity. And the month before, we fixed the water pump and then also hired people to come and do the weed side and the weeding and the cleaning.
Okay.
So it's us and when. We got assembly to do that because the facility had the thing for a while. Then the CNG had rotten and dropped off. So assembly was able to fix that for us. We wrote to them. They fixed the CNG seal and the father had dropped out. So they fixed that. And then they connected us to water, but we had to do the rest after they brought it to the because we have to do the connection to the poly tank and then connect to electricity so the water pumped. So I mean those things are being done, but like I said, it's something that it will be best if we list them. We get the money together, we can do it within a 6 months.
Okay.
But it's not been so. So as the year has gone by, we've done different things because we've used our money. We don't generate. So more or less, if I get groups motivate the company to talk to them, you get something to. But it's not. I mean, nobody will take it upon themselves and do all for you.
Okay.
Someone can help you with this. Someone can help you with a bed. Someone can help you with a wheelchair. That's how we are doing it.
All right.
So it's not the best. Currently, where we are starting CWC and family planning in January. All that is left is the chickens to put on there. Because now electricity and water is there. It's been cleaned. The sample has been put up. It's not a pouring chicken. The chickens have 2,000 cedis for a truck. We need 2 trucks. When we do that, it will start with.
You are sure for more TB. Na more heavy. Ne tenten tete ane se sika ni ho. Nti no assembly ni wie no. E no mo dan ade ne so mo nsan. O man kasa na mo bom homodin. To afoforo. Wona wo bi wono so betumi aboa so mo nso enye den yom yom adoye sika asem be de mo omo de to ni mani bi ne ye 15,000 san so sika se na mo hia se betumi aboa ama omo atumi awie niema wo so mo de sesi hospital na emu da ho na bibia awie peye no eye sika be 20,000 so mo nyesa sika na betumi aboa omo ama niema wo so mo hia na mo de gu hospital ni mu no atumi adi mu nti no ahwefo we de nso ahwebi nti asem bi wo ho ase bibi wo ho a fato comment nasi comment my na ihu ne yeko Ghana ni yimu na yepe yesi we are engaging minds for local and national development impunto ya dia obi ahia na mum yenye ne mayi ne mayi a ebeboa yen we ye Achiato media network musonfo Ignatius Wata Noble and amede community inform edewo kosne de achi subscribe to our YouTube channel Achiato media na ne yekoso bia no e de bebreo empaba koso na de achi edamwase